Hi, I'm Prachi. I'm lactation consultant from Lactation Support. Today we will be discussing about postpartum breast engorgement. Postpartum engorgement occurs normally on day 3 or day 4 post birth when the milk comes in. This postpartum engorgement lasts for 4 to 5 days, but sometimes if the milk is not properly removed, it can last for a longer period. Now let's see what are the symptoms of postpartum breast engorgement. Engorgement is normally generalized and on both sides. Having said that, it's also important to remember that each mother feels this engorgement in different types. Type 1 is when mothers experience one single episode of very firm, tender breasts and then the symptom starts to decline. Type 2 symptoms are when mothers experience multiple peaks of engorgement and then it starts declining. In type 3, the engorgement is more intense and symptoms can continue for 2 weeks or more. Now, let's discuss next symptom, that is pain. Pain is normally generalized and felt on both sides equally. Now, the next symptom is fever. When engorgement is physiological, only there is raised temperature over the engorgement. But when it is pathological or when it's more serious, then mothers might have fever. There are certain factors which can contribute in escalating these conditions. They are first and most important factor escalating this condition is removal of colostrum. If colostrum was not removed from day 1 either by breastfeeding or by hand expression, then chances for escalation of this condition are more. Second factor is sucking of the baby. Normally, even those babies who were sucking well on day 1 or day 2 might not be able to suck so well once the milk comes in and there is an engorgement. This is because the shape of the breast changes and the breastfeeding latch gets affected. Yet another reason could be that baby is having weak sucking reflexes and that's why baby is not able to create effective breastfeeding latch to remove the milk from the engorged breast. Now let's see what are the tips which can help the mother in breastfeeding in spite of postpartum breast engorgement. The first tip is warm shower. The warm shower can be taken for 10 to 15 minutes, 2 to 3 times a day to reduce pain temporarily and to soften the breasts. It can also be done just before feeding the baby as this might help baby in getting a better latch. Second tip is expression of milk. It can either be done manually or by breast pump. The milk should not be expressed too much. Just express enough to soften the breast and make the latch easier. The third tip is to feed the baby when baby is displaying first signs of hunger. This can help the mother and baby to get better breastfeeding latch as baby is more relaxed. Video for baby feeding cues is linked in the description box below. Fourth tip is effective drainage of engorged breast. This can either be done manually or by using a breast pump. Drainage of the breast should be done for 8 to 12 times during 24 hours. If this is not done properly, there are chances that this engorgement will escalate further, or also there are chances that in long term the mother will have low milk supply. The fifth tip is to wear comfortable clothes. Uncomfortable and tight clothes can worsen this situation. Even after following all the above tips, if breastfeeding is still difficult and engorgement is still painful, then it is advisable for you to speak to your lactation consultant regarding this. This was all about postpartum breast engorgement. A detailed post is attached in the description box below along with a free printable. Next time, we shall be discussing about postpartum depression in new mothers.